Helping people with their mobility after an illness or injury is what physiotherapy is all about. Physiotherapists work in all kinds of environments with people of all ages. We visited a physiotherapist to get some personal perspective on this helping occupation.
My name is Cindy Grand and I'm a physiotherapist and I work at the Kinsman Sports Center Physical Therapy Clinic. Physiotherapy is a huge range of things, but most of the time we're looking after the physical care of a patient. So that could be the physical care of somebody in the sports field, it could be the physical care of somebody in an acute setting like a private practice clinic, it could be the physical care of somebody in hospital who's just had a stroke or in palliative care, or the physical care of children with disabilities. A lot of times with private practice, there's a morning shift and there's an afternoon shift. It's not 9 to 5 banking hours in physiotherapy. Sometimes it is with some of the hospital jobs, but there's also a lot of shift work with the hospital jobs. So hours will really vary. For myself, I work the afternoon-evening shift here at the Kinsman Sports Center. So I come in at around 12:30. I start seeing patients at 12:45. So the first thing I do is I log into my computer system and I check my work list. And my work list is things that are coming up that are due. So things like reports that might be due, things like billing questions that my billing people might have had from the day before, just to kind of keep me on track for all of those extra things that are not direct patient care activities. Then my first patient comes in at 12:45, and from there I have patients coming in every 15 minutes or every half an hour for an assessment. I try to schedule myself some breaks here and there because it does get hectic. But you're starting to get more muscle bulk there, so that's great. In my typical day, I have no idea what I'm going to see. Every time a patient comes in, it's new. And even the same injury can manifest differently in different people, so it's always new and always changing. So it's the type of job that you have to be okay with change, and you have to be okay with a lot of gray area. In school, you learn a lot of textbook type learning. The human body doesn't always behave the way that it should in the textbook, and so certainly there's a lot of gray area with physiotherapy, although we do have a lot of science and research backing us up. When a patient comes in, the first thing I do is I talk to them about why they're here. So we talk about their history, we talk about the history of their general health, and then we also talk about the history of whatever particular injury they're coming in to see me for. Then we talk about how the injury occurred. So I want to know the mechanism of injury. I want to know if there were any prior injuries to the area or any prior injuries around the area. As a physiotherapist, I have direct access to patients. So oftentimes as a physiotherapist, I'm the primary caregiver. And so sometimes the patients will not have seen a medical doctor before they come to physiotherapy. So part of my assessment and diagnostic process is to make sure that yes, in fact, this patient is appropriate for physiotherapy, or is it somebody who needs to be referred on to another medical professional. Has it been feeling more sore than usual, or not really? So after we do the history taking, then I start into my physical assessment. And my physical assessment involves a number of tests that I'll systematically go through, and I'll streamline it and get better at streamlining the more you practice to try to get through all the tests that you want to get through, and then at the end come up with a diagnosis. Then I'll discuss the diagnosis with the patient and we'll talk about their treatment goals, because their treatment goals are sometimes different from my treatment goals for them, so we have to make sure we're on the same page and that the patient and I are meshing that way. Manual therapy is the hands-on aspect of the job. So manual therapy encompasses soft tissue techniques, so things like trigger point techniques, things like a little bit of soft tissue massage. Manual therapy also encompasses joint mobilization. Through the orthopedic division of the Canadian Physiotherapy Association, there's a level system where you can specialize in manual therapy. So if you're looking at doing more of the hands-on joint mobilizations and soft tissue techniques, it's very advisable to do the postgraduate program. Most clinics will have small gyms within them because we do a lot of strengthening activities. And so for strengthening activities and for range of motion activities and for agility activities and with my higher level athletes, proprioception and plyometrics, we do use a lot of equipment that way. The physio ball is great for things like core stability. It's good for doing strengthening exercises. Good, and then out. I think to do this job, you really have to be a people person. You really have to have a desire to be in a helping profession, because the bottom line here is patient care. It's also a very physical job, so you need to be prepared to be on your feet, you need to be prepared to be lifting limbs in the private practice, you need to be prepared to be doing patient transfers in a hospital setting, so it's quite a physical job as well. Multitasking would be a great asset in this job, because lots of times I have 3 or 4 or 5 patients on the go, and they're not all coming in with the same type of injury, so definitely there's a lot of thinking on your feet that has to happen as well. I think if you're interested in pursuing this occupation, definitely do some job shadowing. And do some job shadowing in a bunch of different areas, because physiotherapy can encompass so many different areas. The really nice thing about this job is you can pursue many different directions with physiotherapy. So if you're interested in working in a hospital, if you're interested in working with kids, there's also home care, there's acupuncture. So I would say definitely do some job shadowing or talk to people who are in the profession to see really what it's going to be like. Being a physiotherapist allows me to have a great lifestyle. Working in private practice, there's generally a morning shift and an afternoon shift. And I'm an afternoon evening girl. So one of the things that I love to do in the morning, especially on a beautiful sunny morning, is come out and have a cross-country ski. So lifestyle is really important, and having a healthy lifestyle is important in my work, and it's also important for me. So for me, physiotherapy is a great fit. I really enjoy working with people. I really enjoy helping them to reach their goals, and I really enjoy also educating them about their body. And when that light comes on for a patient and they get it and they get what they have to do in order to get themselves better, it's really quite rewarding for me.
To become a physiotherapist, you will typically require 6 or more years of post-secondary studies and the successful completion of a competency exam. If working as a physiotherapist interests you, there's more information available, including salary ranges and educational requirements, in the occupational profiles on ALICE. You may also be interested in the related occupations of massage therapist, occupational therapist, and sport medicine physician. Learn more on the ALICE website and make the most of your future. Visit us at alice.alberta.ca.